Welcome to our new Coalition Corner podcast series in which we discuss critical issues in the Caribbean's human rights and HIV response and meet some of the key players in the field. The podcast is brought to you by the Caribbean Vulnerable Communities CVC. I'm CVC's communication consultant, Keneal Gale.
And I'm Ivan Cruikshank, CVC's executive director. In this episode, we look at PrEP, pre-exposure prophylaxis, as a new and innovative tool in the HIV response, as well as discuss the rollout of the service in Jamaica and in Guyana. With us today are Dr. Sasha Blackwood from CHARES and Joel Simpson from SASOD, Guyana.
Joel, let's start with you. Tell us a little bit about your work in Guyana and SASOD. A little bit about SASOD. Tell our listeners a little bit about SASOD.
Yes, SASOD Guyana is over 20-year-old human rights organization and movement that's leading change, educating and serving communities to end discrimination based on sexuality and gender in Guyana. And in that context, we have a human services program that seeks to research and find solutions to some of the critical socioeconomic challenges that vulnerable and marginalized populations that we serve face. And traditionally, those have been around health, especially sexual and mental health. And a huge part of that for us was advocating to have the most modern HIV prevention technologies and services available in Guyana. So we started advocating for PrEP to be fully accessible in our public health system in 2016. And 5 years later, in 2021, we finally achieved that goal when our Ministry of Health's National AIDS Program Secretariat announced that with our new HIV country strategy, 2021 to 2025, that the rollout of PrEP was something that they were going to do and have PrEP available in the public health system for free. Prior to that, because of our advocacy, there was limited availability. It was only for persons who are HIV negative, whose partners were HIV positive. So what's called serodiscordant couples. Not a terminology that the average person understands, but it wasn't available for anybody else. And now in Guyana, anybody who wants PrEP and think they're at risk of HIV and could benefit from this service and medication could go into a public health site that provides HIV treatment and prevention services and have a discussion with public health workers about PrEP.
All right, we'll go further into the Guyana PrEP experience in a bit, but Dr. Blackwood, over to you.
Hi, afternoon. I am Dr. Sasha Blackwood. I am the clinical advisor for UCSF Jamaica Country Programs. I work very closely with CHARES, which is one of the sites that are currently offering PrEP in Jamaica. So what CHARES stands for is the Center for HIV/AIDS Research Education Services. So it's a clinic that is located on the University Hospital compound, and it offers a wide variety of services surrounding HIV. So it extends from prevention to treatment, right? They offer social services, psychological services, as well as treatment services. So we were one of the first sites when it came to the rollout of PrEP, what we call the PrEP pilot study. And that happened in 2020. So there were two sites that were involved in the rollout of PrEP. So you had Jamaica AIDS Support for Life and you had CHARES. We had two different target populations at the time, right? Because as I said, it was just a pilot study. They wanted to see how well PrEP would work in Jamaica. So CHARES was responsible for getting those serodifferent, basically meaning if you have one person that's positive, one person that's negative, couples who wanted or were interested in pregnancy. So that was what CHARES was tasked with at the time. While JASLA, which is Jamaica AIDS Support for Life, they were tasked with just getting any MSMs who were interested in getting on PrEP. So for CHARES, the rollout was a little bit different because I wanted to picture you in the middle of COVID, right? Who wants to get pregnant in the middle of COVID, looking at everything that was happening, all of that. So that was a little bit of a challenge because we were tasked with finding 25 couples who were saying, I am ready to have a child, I am financially stable, everything that can happen to have a child. So that was where we were positioned in the rollout, in the pilot, I should say, of PrEP. But we learned a lot of valuable lessons from that particular pilot program. We weren't able to get 25 persons. We got 14. And we did end up with one successful pregnancy from that particular study. And then being involved in that pilot study was what positioned us to be involved in the general rollout of PrEP in 2022 when we actually started rolling out PrEP at CHARES. However, following the pilot study, JASA went straight into rolling out PrEP. So from 2021, they had their PrEP program. They were on the ball, getting their persons involved. But for us, it was started in 2022.
All right, let's go back a little bit. For those not familiar with PrEP, what exactly is it?
All right, so PrEP stands for pre-exposure prophylaxis, right? We're going to break it down. So what it is, it's a pill, right, that you can take. You have to be HIV negative to take this particular pill, and it will prevent you from acquiring HIV. So again, simple put, it's a pill that prevents you from getting HIV. So the main thing is you have to be HIV negative to get on PrEP. Now, who gets PrEP? Well, we would say anybody who considers themselves at a substantial risk of getting HIV. So we offer PrEP to anybody who will come in and say, I think I want PrEP because this is what is happening. And we just walk you through the process of getting on that particular pill.
So I have a question as you talk about the pill, because in my mind, and I think in a lot of people's mind, the question comes up, why should I take a pill to, for protection when I could use a condom? If you were to respond to that, both of you, if you were to respond to such individuals, what would you say to them is the benefit of using PrEP versus other tools that might be out there?
Well, first thing I would say, if I can, is, PrEP is more effective than any other method. If I remember the stats on efficacy, it's probably they say 99.9%.
Right.
And condoms don't go that high. But we also advise people.
Burst.
Yeah, they could burst. They could be expired. People have reported stories of people trying to sabotage condoms and all of that and so on, board a condom for different reasons. So this is an effective layer of biomedical protection that a physical barrier can't provide.
Right. So,
and I would say second to that, we advise people to use both, though, combination prevention, because it's also important to remember that the pill, like Doc says, the pill prevents HIV, but they have a whole heap of other sexually transmitted diseases and infections, a whole heap out there that the pill can't protect, but the physical barrier protects you from that. So my advice is yes to the pill and condoms for that reason and for those reasons.
Yeah. So I have a follow-up question for that, but I'll have go on, then I come back to you.
So definitely, to piggyback on what Joel was saying, when we look at PrEP and how effective PrEP is, it's up to 99.9% effective when taken as prescribed or as you should take it. Because we have to put that in there to be real, because we do have persons who may take it today and not take it tomorrow, may take it that following week and really think that it's still as effective. So I'm going to always throw in my doctor hat here and say, when taken as prescribed. And of course, as Joel was saying, there has been a lot of incidences, especially in clinic, where I have seen persons come in and they would tell us that condoms burst. I realize a lot of people don't know how to put on condoms properly as well. So you do have a lot of accidents when it comes to that in particular. And sadly to say, we do have those acts of sabotage where I've had persons come in and say midway, particularly during any particular sexual intercourse or experience, condoms have been taken off and they didn't know. So we always say this is like an additional layer of protection, right? Against HIV alone, of course. So we do have to stress that it doesn't prevent any other sexually transmitted infections and pregnancy as well. I like to throw that out there. But definitely as a biomedical or as an additional layer of protection, PrEP is here to prevent you from getting HIV.
Yeah. There is, when you look at the uptake of condom, or the use of condom, I think across the region, and you probably can say a little bit about what's happening in Ghana. I don't know, Sasha, you can say a little bit about what the use of condom, the evidence about use of condom shows that it is not widely used as we would have liked it. So would you use that as one of your arguments to say, yes, move to using PrEP because of we see clearly what we see is a lack of desire on the part of many people to use condom.
Yeah, that would be part of the argument, but I don't want to give the impression that I'm saying because you're on PrEP, you don't have to use condoms. I would say get on PrEP if you're sexually active and think you're at substantial risk of contracting HIV for whatever reason. You have multiple partners, you don't trust your partner, you think they're cheating, they might be, they might be giving blow without using protection, all of those kinds of things. Or you're in a relationship where there's an imbalance of power and you can't negotiate safe sex, all kinds of various reasons. I would say use PrEP to have that biomedical protection. Still use condoms, but if the condom fails for one of those reasons, you slip it off when you're not looking, it's expired, it bore, whatever, it didn't put on properly, at the very least you won't get HIV. You might have been exposed to something else, but it won't be HIV. So I always advocate for both, realizing that we don't live in a perfect world and everything is not going to be perfect all the time. But you should strive to use both because combination prevention is most effective.
Hold on, giving blow is Guyanese for cheating.
Oh yes, sorry. We also here in Jamaica.
Jamaica, we say give bun.
Give bun, right? Yeah,
I was supposed to ask. Let me find out what that means before my mind is thinking something else.
When I heard the give blow, I thought it was give blow, but
I was thinking literally like.
Yeah, I'm glad you clarified that.
Thank you very much.
I'm glad to clarify because we have a Caribbean audience, and I feel the Southern Caribbean would have understood that very clearly, but not necessarily the Northern Caribbean.
But we would have probably just interpreted it as something else. Because I really just was. That was what I was doing until you asked.
I'm grateful for that intervention.
Yeah, thank you very much. So now I can clear my mind.
Culturally specific.
Right.
But yeah, I have one question. I have a question, which is. Both of you would have been at some point involved in the rollout at some point. I don't know. You SASOD, you can tell us a little bit about the SASOD involvement in the rollout in Ghana, what role you guys play, whether it is to demand creation, whatever it is. And then in answering that, share a little bit about both the pluses and the minuses of that experience.
Yeah.
Because I know it would not have just been a smooth sailing process. So I want to start, Sasha, and then...
All right, so in the rollout of PrEP, in our Jamaican situation, as I would have said before, it was started with JASL as well as CHARES. It has been a little bit tricky because definitely only certain populations would have known a lot about PrEP in terms of your MSMs would be very educated as it comes to PrEP, and they would be the ones coming to ask about PrEP. But in terms of further knowledge, there are lots of persons who really didn't know about PrEP. So part of that rollout was really communication, getting the education out there, getting the information out there to persons, right? Now, it was a little bit tricky in terms of we would have done like radio interviews, we would have done text message blasts. And I know for me, a lot of persons would have responded to those text messages to say, why are you sending this to me? I feel like I'm targeted. So we did have those persons who were it was unwanted on their part, but it did pique their interest. And then having those persons come in, then we realized that some persons really just heard about it and decided that they wanted to come, but they really didn't want to get on PrEP. They just heard something or they saw something and decided that they were going to come in, but having that conversation with them, right? And I'm going to be real. In the Jamaican context, when we talk about somebody having to take a pill, we are not a pill-taking country, right? These are healthy individuals, right? We have persons who don't want to even take pills for the high blood pressure and diabetes, right? It is a struggle. So to get somebody who's healthy now to say, let me take a pill a day, and I will congratulate myself. I'm not saying a pill a day. You guys would know where I'm coming from in terms of how I used to surf when I was talking to PrEP. But I mean, it's a challenge because then you're going to have to sit down and have that particular conversation when these persons come in. And I'll tell you, a lot of persons will say, I don't think I can manage this. Right? I don't think I can get to the point where I can take this pill every single day. So even when we would have done that rollout, all of the blasts, all of the information, education, everything that was happening, when they actually had the interest, the gap between persons who were interested and those who actually started on PrEP was a huge gap. And that was because persons were learning about what it took to take this medication, this pill, sorry. So they knew, right, that it would prevent HIV, but then they heard about having to take something daily, and that is where the issue now lies with getting persons to stay on PrEP, even though they may still be in a high-risk situation, because we have quite a few people who are in that high-risk situation still. They are missing pills. They're not staying on PrEP because, as I said, we're not a pill-taking country. So it's just trying to navigate how do we get persons to understand that this is here for your protection, right? As well as still, which another issue is the condom use as well, because here we're saying, here's something to prevent HIV, right? But still using condoms. So I will tell you, especially with what has been happening now, having completed our communications and having patients on board, my challenge now lies in saying, hey, you still need to use your condom.
Yeah.
And that has been difficult because that is something that we have to ask on every visit when you come in. Are you still, and I will get the no's from majority of the persons. So I do get it. We're saying, here's something that's preventing HIV, but go and go use the condom still.
Is it that people feel like there is a kind of level of protection? So even though, yes, you're supposed to use a condom, if I forget this one time or if I don't get to use it this time, I'm good, I can use it the next time.
For me, let me tell you what I would think when it comes to the condom use. I think because other STIs are something that you can treat, right? Apart from, you have like your herpes or so that will have flares, because other STIs are things that you can treat. They would say, okay, I'm protected against what I consider the most dangerous one. Your risk analysis. You're protected against this one. I know if I get the other one, I can go to my doctor, get 2 pills, get an injection, and I'm good to go. But I'm protecting myself against HIV. So I'll take my chances. And that's where we come in to keep educating, to say, have you seen the latest studies to say that this drug-resistant gonorrhea is happening?
Yeah.
In Guyana, well, it's a very, very different experience. It's really like the tale of two countries. And I learned a lot from what Doc just said, and I learned about CHARES because I'm more familiar with Jazzle's work. I wouldn't even call what we have in Guyana a rollout, quite honestly. So we've had a situation where, we won this policy battle, and government now has to make these services available in centers. It's at what we call our National Care and Treatment Center, which is our largest facility that provides treatment and testing and other sexual health services. And it's at a number of the other kind of like hospitals and community clinics, particularly in the capital region, Region 4, where Georgetown, the capital of Guyana, is. And some of the other bigger regions are now starting to get centers. But there has been no civil society involvement in the rollout in the way that I hear the Jamaican Support for Life has a role here in Jamaica. There's been no promotion, education, advertising that the service is available. So it's like, you train the healthcare workers, you get them the pills, everything is there, and there's no education, promotion, advertising to get people to come. So
why wasn't CSOs involved though?
I don't know. I don't know. So we on our own now are going to be, we're hoping to launch a social media campaign that promotes self-testing and PrEP in Guyana. And we have had to search very long and hard to find some resources to be able to do that on our own. And yes, I think that's why in a country of about 800,000 people, and that includes the 20,000 documented migrants from Venezuela fleeing the crisis there. I want to give the numbers to people who don't know Guyana's population size to have context. That last I checked, and we check in quite quarterly to see how many people are on PrEP. Last time there were under 100 people in the country on PrEP after the service came and was fully available in maybe the first quarter of 2022. It was announced and launched on World AIDS Day of 2021. So maybe by March or so, it was actually in clinic. So it's been over a year, 18 months, and less than 100 people on PrEP. And for that very reason, I listened to Doc talking about all the research that was been done in Jamaica and the pilots and all of that. And obviously supported at a governmental level in this context. For us, the studies done on PrEP in Guyana is what we had to do as civil society. And we did that as part of our advocacy when we started in 2016. We did what we called knowledge, attitudes, and perceptions assessment of PrEP. Focus on the communities that we primarily see as our beneficiaries because we couldn't do all of Guyana. And we focused on men who have sex with men and transgender women. Not that PrEP isn't for anybody else, but that's our primary clientele. And we found alarming results, like people just didn't know what it is, understand what it is. And we used a focus group methodology. And after we did that kind of ask those kinds of questions, then we said, okay, this is what it is. Would you use it? And after we said that to our communities, they said yes. And they talked about how they wanted education to be done. The country is split up into 10 administrative regions. So you hear me calling regions by numbers. It's the same like it's similar to what you would call parishes here in Jamaica. So in region 6 of the country, and that is the region that is closest to Suriname, to the Suriname border. We consider that a rural region, and the majority of the population is Indo-Guyanese. And in that region, the communities are clear that they also wanted to be able to get their services from their local community-based organizations. In particular, FACT, Family Awareness, Consciousness, Togetherness, was singled out as an organization that our communities trust for HIV services, and they wanted to also have the option of going into FACT and get those services. Things like that have not been considered in the Guyanese context, unfortunately. So we on our own are going to do our best to at least promote the service and get people to utilize it.
It's interesting. It's an interesting point that you're segueing into there, because I wanted to ask a question earlier on in light of what you said about where it is being rolled out, and you also said that do you see it an issue with the uptake of PrEP because of the centers where they are being delivered? So they tend to look like hospital treatment sites. The definition of being sick. If I'm sick, I go to a hospital. If I'm sick, I go to a clinic. I'm not sick. And if I go to a clinic, I'm going to wait for several hours to get through. I'm not sick. I don't need to put myself through that hassle.
Yep.
Do you find that is an issue in the uptake of PrEP in both countries?
It is in Guyana. I remember a friend of mine who said to me, I'm not on the PrEP thing because I don't want to go to those sites where people go for treatment. I don't even want to go there for an HIV test because I don't want to be seen going there, because I don't want anybody to even think that I might have HIV. And I'm like, are you serious? These centers and these clinics and so on provide a range of services. You won't even go there? So the person said to me, yeah. But what we've done in Guyana, though, we have PrEP available at a couple of private hospitals as well. And
but
some people
hospital.
Huh? Again, it's hospital. But even for that friend, I said, okay, I rather even though this thing is free in the public health system, I rather go to the private hospital and pay more money for the service, because I could be going to the private hospital for any or a range of things.
So it's about the perception of others, where they see you go.
Yeah, and it's still sad that we're at that level when it comes to, although we've done all of this education and work across the region on stigma and discrimination. I also think that we have one very strong civil society organization that does health services, and that's the Ghana Responsible Parenthood Association, GRPA. But it's only in the capital city, and it's the only one of its kind that has, a clinic and a doctor and does direct services. They don't even do HIV treatment yet, so PrEP is still down the line. But I think even having an organization like that provide the service is going to be helpful. But there are other models as well. Equals Barbados, an organization that works with lesbian, gay, bisexual, and transgender people there. They have ran a weekly part-time evening clinic where people could go in on a Wednesday evening or whatever it is, see a doctor, get the services there. The organization might send they'll draw the blood or whatever, send it to the labs. You come back the next week for your results. You get your, and we have to find those we call it differentiated models.
Right.
We have to look at those kinds of differentiated models in order to reach the people who need to get the services.
Right. So definitely, I'll just pick on the tail end of what Joel was saying. What we would have had to do in terms of because as you said, it's our hospital, it's a clinic, right? So it's that self-stigma, one of those particular things, right? To say I am not sick, but also to say, let's be real, these are treatment sites, right? When it comes to HIV. So what we would have had to do is kind of be creative in terms of the hours that we offer, in terms of offering it after hours, offering on weekends, where you wouldn't have a general population that is there for the regular visits per se. And I think that's what may be happening in terms of the rollouts in our public system in Jamaica, because they are set to rollouts in clinics. Clinics are supposed to be offering it in Jamaica. But the issue then becomes, it's a clinic. You're going to be there with a long waiting time, lots of people. And then we have to look at staffing as well, because we're utilizing the same set of staff to offer PrEP, to offer regular curative services, whether it be HIV, diabetes, hypertension. So even though they're driving PrEP in terms of general health centers, right, it's still gravitated towards your JASL, your CHARES, because these organizations have tried to tailor more differentiated service delivery per se to these particular individuals to say, all right, let's just try to meet them at a time that is best for them. Definitely though, in talking to the patients, Ivan, they'll tell you, say, if I could get this somewhere in my community, in a community-based model, I would be very, very comfortable instead of having to come onto the hospital compound or clinic compound. But I do know there are a couple of private doctors as well that the government would have partnered with in order to get those persons to offer PrEP too. But definitely in talking to persons, or even when we have these educational seminars or functions out of CHARES, we will hear that, hey, we prefer these kind of interactions, these kinds of service delivery when it comes to offering PrEP. But we are thinking about ways in which to meet in terms of, because we still have to do our examinations, everything that is necessary to offer PrEP. So definitely, I do agree with you on that one. Coming to a hospital or health center can be a daunting thing if you're a healthy person.
So you mentioned self-testing. We're not doing self-testing today, but PrEP and self-testing have been sort of earmarked as what will change the trajectory of the HIV epidemic in the Caribbean. What are your thoughts on that?
Particularly around PrEP, I think PrEP is going to definitely change the trajectory.
Despite the issues around
Despite
uptake?
the challenges, and because I think the uptake issues can be solved with education, marketing campaigns, advertising. We're not doing any of that in Guyana. I'm so inspired by the work that JASL does around that, and we've met with JASL communication staff to learn about some of their strategies and, in preparation for our own campaigns. I think that is going to be, the silver bullet, so to speak, for Guyana. Particularly because what motivated us to start to advocate for PrEP is when we started reading about how it was slashing new infections in the metropolitan cities, New York, Toronto, London, Sydney, all over the world, particularly among key populations.
But I dare say though, white key population. So let's talk a little bit about that.
So what I'm hearing Ivan saying is that we need to insert our cultural relevance in it and figure out how we can learn from that, but still skew it towards our cultural reality.
Yeah, but let me add another piece, which is funny that this is being considered in Guyana. And I don't know if this is also the solution, but at least at the level of our public health officials, they're thinking about this. There's already injectable PrEP And even with the low uptake of the tablets, they're talking about bringing injectable PrEP together. And no opposition to that because it gives people options.
Yes.
A lot of people also don't like injections, right?
But they prefer it over the pill.
Okay, well, I don't know that. I don't know any Guyanese context that, and then also the science is improving. I think the last I read is like injectable PrEP at first, they might have started like you need one injection every 2 months or 3 months. I think they're doing studies about a 6-month injection and so on and so on.
Yeah, and that might be more palatable to people instead of popping a pill every day.
Yeah.
Just taking an injection every 3 months or so.
So I know that our national program is looking. It's so funny because you would not think they would be considering this with such a low uptake, but I know that they're looking at the possibility of getting that so that people have options. Yeah. But honestly, we're really missing the mark in Guyana. You can't just put the service primarily in the public health system, do no education, do no advertising, do no promotion,
right, I was just
and expect people to come.
If you're going to move towards injectable PrEP, then there has to be some lessons learned from what happened with the pill to say, all right,
they probably just said
this is where we went wrong.
So let us just
the pill not work, let me get them some injection.
But you can't just substitute one for the other and think that it's going to work.
It can be done.
So, I mean,
whether it will work is another question.
Right.
Definitely. So what we would have done through CHARES and UCSF, which works very closely with CHARES, is kind of do some more research into what is happening in terms of the uptake in PrEP. Why are people hesitant to start PrEP, right? Definitely a lot of persons, the education factor, right? So I think in the future, going further with our rollout of PrEP, we definitely need to have more in terms of education on PrEP and getting the education to the people.
Not just promotion.
But education.
Yeah.
So we can promote it all we want, but we definitely need to be able to have these educational seminars at the level of where we plan to offer PrEP.
And I agree with that because how does somebody know if they're an ideal candidate for PrEP? Instead of, you see it out there and say, yes, this can prevent HIV, but how do you know if this is for you?
It requires a deeper discussion.
Right, and it requires that exactly, Evan. It requires a deeper discussion, and we realize that through promotion, it enables the education. Because what will happen then is we'll allow for numbers to contact or persons who you can talk to find out what is happening or am I ideal for PrEP? What exactly is PrEP? Because we can't come here and just say it's a pill that you take, but you need to know more about it. Persons want to know more about it, right? How will PrEP help me per se? Or I am hypertensive, diabetic, can I still take PrEP? These are real questions.
And persons are concerned about side effects.
Persons are concerned about side effects as well. So definitely I think going further, and I'm gonna say this is where ministry for us in Jamaica is on board because this is ministry driven as well from the pilot program come all the way down to the rollout, right? Even how we get medications, it's through our ministry in Jamaica. So essentially having the governments on board as well as doing the research through these private entities, then we kind of have that market to say, these are the issues, let us address these particular issues where education was one of them, right? As well as just being able to access the service and access the service in a timely manner where I don't have to go and sit down for 6 hours and I'm not sick per se.
Or showing up to the facility and they're not offering the services yet.
Right, exactly. Or showing up and saying, we don't have the pill today, I have to come back tomorrow. Because these are things that turn away persons. Because I may be ready today, but then tomorrow, no.
I changed my mind.
I can't bother, I changed my mind. So definitely.
Sasha, you mentioned, as you were talking, you kept talking about one a day. Quite a catchy phrase. Actually, there's a pill named One a Day. A set of vitamins.
Yeah.
But one a day actually, as you've mentioned, is a turn-off for some people.
Right.
Can you say a little bit about what are the options people have? Because I know there's the one a day, but there are also other ways that we can do it. So you can talk a little bit about that.
We have what is called PrEP on demand. Right now, PrEP on demand, just like how we would have had a pilot or a little study happening in certain sites before it went to government sites. Currently, we're putting together protocols to roll it out in JASL and CHARES, right? Wherein PrEP on demand is basically if you can say, I know that I have 2 hours before I'm going to engage in sexual intercourse, so I can predict it, right? You can basically take a set of pills 2 to 24 hours before, right? And then one 24 hours after the first set, and then another pill 24 hours after that. Now, this is for persons who would say can predict that this is going to happen, and it's for persons who are, I would want to say, infrequent in terms of their sexual activity. And it's really this is where I'd have to say for men who have sex with men in terms of just anal receptive sex, because it's not for females, right? It's just targeted to a particular audience per se, right?
Oh, so PrEP so only MSM
would be eligible for PrEP on demand. And I'm saying it straight off the bat because I know I've had heterosexual men who would have come in and wanted to be candidates for going on PrEP on demand, and we'd have to explain based on what's happening in terms of the evidence doesn't support the effectiveness at that particular time. So there's a particular set where we target for PrEP on demand. And of course, you have the injectables as well. But while we are looking into it, the government has started, especially talking with some of the program development officers in ministry, thinking about it. We're still trying to get the pill off the ground, right? But definitely we're rolling out PrEP on demand as well in 2 sites to see how it happens first, and then we can go with offering it in the government based on how the responses are.
Yeah, because I've been thinking about it, and given our lack of desire for pills, our sense that pill is pretty much a treatment issue, I'm not ill. And so
if you're not sick, there's no reason to take a pill.
And so for me, pushing, I've always felt that pushing PrEP on demand as a strategy makes sense, but acknowledging that it doesn't work for everybody and every setting.
Yeah.
But I knew we were pushing.
And also the advent of injectables now.
Yeah.
Right.
I know we're pushing the daily pill because that's what we started with, but I think at some point we need to recalibrate and say, how do we ensure that we promote the different options?
PrEP on demand is coming. It's coming. It's being rolled out. So definitely, ministry has their protocols in place for PrEP on demand. As I said, it's just to roll out, but to highlight that at the end of the day, if you don't meet certain criteria, you can't get PrEP on demand per se, right? And if it becomes a situation where somebody has to take PrEP on demand frequently, it's better to just say daily PrEP.
Yeah. In Guyana is very similar. Guyana is very similar. So remember, our context is very low uptake. So even with people asking about PrEP on demand, the response for us is that's a conversation for you to have with you and your doctor, a one-on-one conversation. And that is where, like what Doc said, the doc would raise questions about, if you can predict and plan your sex life. Are you one of those people who are able to do that? And also which key population, group that you might fall under. And we leave that to a one-on-one conversation, and there's no discussion about PrEP on demand in public in the Guyanese context because, the uptake is so low to begin with. We can't start to push something like that, especially given the narrow criteria that you need to meet to be able to benefit in that way.
So we have talked a lot about PrEP, and I'm sure some of our listeners out there are still uncertain. I don't know if this thing is for me. I hear them talking about, on-demand PrEP. I hear talking about one a day. I hear talking about meeting criteria. I hear the possibility of side effects. I'm still uncertain about this thing. What would you say to somebody who is in that position, who is still uncertain because they still haven't fully wrapped their head around the benefits of going on PrEP?
And this is somebody who has identified that there are within this group. Within the risk group.
Somebody who just think of themselves as a high risk. They are substantial.
They just can't wrap their head around whether or not they're ready to start PrEP. So definitely for me, this is where I would say then you can contact the sites and contact the persons who are offering PrEP and have a discussion. Because at the end of the day, I think that one-on-one discussion with these persons is really where we get to see what are your factors that are causing you not to want, or your hesitancy factors as it relates to going on PrEP. So I would definitely say come in, talk, or call, or we'd provide particular contact numbers. You can come in, talk, and let's see further in terms of, if you're an ideal candidate as it relates to PrEP, or what is it that we can address or help you overcome as it relates to getting on PrEP. Because as I said, I think the one-on-one conversation now becomes very important for that person to find out what are the factors that are hindering them.
Yeah.
So
this was exactly what...
Somebody listening in Jamaica say, I hear this nice doctor lady on the podcast. I said we can talk to somebody. Who can they talk to?
I'm going to give them the phone numbers to call.
Exactly.
Right? So they can contact CHARES, which is located on University Hospital. The number is 977-6921. And then the other number is 379-6848. So you can WhatsApp that nice number. So 379-6848. And definitely we will talk to you, discuss with you further, and get you to the place where you want to go on PrEP.
Okay. So those are Jamaican numbers.
Yes.
I'll ask you the same question.
Well, I'm going to tell them to Google the National AIDS program, the National AIDS hotline number. I don't remember it off the top of my head. Google is your friend. You'll pick it up easily online. But I was going to say, that's exactly the same thing I would say as a non-medical professional. I don't ever try to convince anybody that PrEP is exactly right for them. Mm-hmm. That is a conversation for between you and your doctor. Mm-hmm. Maybe you think you're at substantial risk and you're not, right? Or maybe you think you're not at substantial risk, but you really are, right? So, and are you the person like, okay, you might be in a visiting relationship, so you might not need PrEP every day. You might need it on demand. Your partner works on a cruise ship and you have one partner and all of that and so on. So you could plan it, you could schedule it. So all of those things have to be considered about if PrEP is right for you and how every day on demand and all of that. So I never try to convince an individual, yes, get on PrEP. No, I just say, go and talk to the doctor. Mm-hmm. In Georgetown, our largest site for services is the National Care and Treatment Center, and for SASOD Guyana, we have a very good relationship with them. But there's so many sites across the coast of the country, mostly in the urban regions, but also a couple in the rural regions. Unfortunately, it's not in the interior regions yet. But imagine if the uptake is so low in places where you have internet and broadcast television and radio accessible. It's going to be even more challenging in the interior. So in the Guyanese context, just please, Google is your friend. Look up the number for the National AIDS program, the National AIDS hotline, we call it, and just call. And there's always somebody there who's willing to talk to you and guide you to services in your particular region. Because for us, there'll be a lot of options depending on where in the country you are.
Could they call SASOD to get direction for who to talk to, etc.?
They can contact us, especially if you feel like you fall within a marginalized or vulnerable group. I mean, anybody can call SASOD, but you can contact us, especially if you feel you fall within one of those groups and you want to go to a site that is sensitive to you as a gay man or a trans woman or a woman in an abusive relationship, whatever the case is. And one of the things that we do, we could say, okay, where you are, okay, we know Dr. Moore at the National Care and Treatment Center. Let us set up an appointment for you with Dr. Moore. She's expecting you at this time. You go directly to Dr. Moore. So for that, you could reach out to SASOD on our social media as at SASOD Guyana on Twitter, Facebook, Instagram, TikTok, all of that. Or you can call at +592 623 5155. Number again is +592 623 5155.
Right. This has been quite an interesting conversation. I hope you, our listeners, enjoy the conversation as much as we did. I really appreciate the insights from both Guyana and Jamaica. The message is clear. This thing called PrEP is out there. It's an available option for people who are at risk and substantial risk for HIV. If you think you fall within that grouping, reach out to any one of the numbers that were given. There is a number of CHARES. I don't remember the number, but
I will say it again.
If you go to the CVC website as well, or on our social media pages, you will also see the numbers in the various postings that we have there. And there is a Guyana social media pages from SASOD that you can actually go to. And as Joel said, Google is your best friend. Use it. if you need additional information, but also if you need to make contact with individuals. Really, really want to thank you, Joel and Sasha. Anil?
And that's all the time we have for this podcast. Thanks again to Joel Simpson from SASOD Guyana and Dr. Sasha Blackwood from CHARES at the University of the West Indies.
And remember, we continue to have these podcasts. You listen out for the next episode. As usual, we'll have an interesting topic and very, very interesting guests.
Yeah.
I will not tell you who the guest will be today, but when we announce the new program, you'll be excited at the dream guest that we will have on. Thank you again for listening. And as usual, walk good.
Take care, guys.